Hello, today we are going to be talking about asthma. What is asthma? Asthma is a chronic inflammatory disease of the respiratory system. A chronic inflammation causes an increase in the airway hyper-responsiveness that leads to recurrent episodes of wheezing, breathlessness, chest tightness, and cough, particularly at night or early in the morning. It is the most common disease in children and affects an estimated 262 million people in 2019 and caused 461,000 deaths. Before the age of 18 years old, males are typically more affected than females, but over the age of 18, females are typically more affected than males. There are two kinds of asthma, allergic and non-allergic asthma. Allergic asthma is the most common type of asthma. It usually begins in childhood and presents as intermittent symptoms. It is usually associated with atopy as atopic triad. Atopic triad includes three diseases: atopic dermatitis, allergic rhinitis, and asthma itself. It is triggered by different factors like pollen, dust mites. These are environmental factors. Other environmental factors include animals, mold, and so on. Food like nuts, fruits can also cause allergies. Different people have their different triggers. Non-allergic asthma typically occurs in people older than 40 years old and can have different triggers like cold air, medications like aspirin, exercise, viral infections, and so on. Stress, exposure to irritants like tobacco and wood smoking can also increase the risk of asthma. There is no exact known etiology of asthma, but other risk factors include family history of asthma, past allergies, and low economic status. There are three main processes that are involved in the pathogenesis of asthma. This includes bronchial hyper-responsiveness, bronchial inflammation, and bronchial obstruction. It's a disease driven by T helper 2 cells that manifests in individuals with a genetic predisposition. Bronchial inflammation primarily occurs in the terminal bronchioles because it is mainly lined with smooth muscles. The exposure to allergens, cytokines are produced by the T helper 2 cells, cytokines like interleukin 3, 4, 5, and 13, and this leads to activation of eosinophils and induction of cellular response, which is the B cell IgE production, and leads to edema of the smooth muscle and the bronchioles collapse. The last stage of pathogenesis of asthma is the bronchial obstruction. This is characterized by the hypertrophy of the smooth muscle cell, increased mucus production, edema, tight infiltration into the mucosa with hyperplasia of the goblet cells, and also the reversible bronchospasm. All this leads to the decrease of the diameter of bronchioles and leads to asthma symptoms. Symptoms of asthma can occur sporadically or as a response to a trigger. The symptoms include wheezing, dyspnea that occurs at expiration, persistent cough that might be dry or productive with mucus excretion, and worsens at night. They may experience chest tightness too. At acute exacerbation, which is also called asthmatic attack, these symptoms are increased, and additional symptoms like tachypnea, tachycardia, pulses, paradoxis, hypoxemia, altered mental status are observed. Classifications based on severity: we have the intermittent asthma, mild persistent asthma, moderate persistent, and the severe persistent. In intermittent asthma, the symptoms occur less than 2 times per week and there is no interference with their daily life. The use of short-acting beta agonists is limited to less than 2 times per week. Mild persistent asthma, the symptoms occur more than 2 times per week. There is a minor limitation in daily life. The use of short-acting beta agonists is more than twice a week. At moderate persistent asthma, there may be some limitation in daily life, daily use of short-acting beta agonists, and they may be waking up due to symptoms around 1 time per week, and the symptoms occur daily. There is also a decrease in lung function. Severe persistent asthma, the daily symptoms is throughout the day. They wake up due to symptoms frequently every night. There is extreme limitation of daily life, and the use of short-acting beta agonist is set several times per day. Lung capacity is greatly reduced. Diagnosis of asthma can be done by the combination of symptoms and the pulmonary function test in patients older than 5 years old. If the pulmonary function test is inconclusive, we can use the bronchial provocation tests. Pulmonary function tests include the peak flow meter, spirometry, bronchial reversibility tests. Other tests include the allergic workup, which includes the skin allergic test, which is the skin prick test, and also the intradermal skin testing. And it also includes the CBC to check the possible eosinophilium, and also the antibody testing to check for the IgE increase. Sputum analysis, although not routinely recommended, can also be done. Kirschmann spirals, circulating cells, preolar bodies can be seen. The treatment of asthma is done by the administration of short-acting beta-agonists, long-acting beta-agonists, inhaled corticosteroids, oral corticosteroids, leukotriene receptor antagonists. Long and short-acting beta-2 agonists work by dilation of the bronchial smooth muscles. Short-acting beta-2 agonist is used at acute exacerbation of asthma. Long-acting is used for long-term maintenance. Inhaled corticosteroids work by inhibiting transcription factors and decrease inflammation. They are also used for long-term maintenance. Oral corticosteroids are used in severe persistent asthma. Inhaled corticosteroids only take effect after being used for 1 week. Leukotriene receptor antagonists work by decreasing bronchoconstriction and is really effective at exercise-induced asthma and also aspirin-induced asthma, and it is also really effective in children for long-term maintenance. Monoclonal antibodies, methylxanthines, mast cell stabilizers, leukotriene modifiers, muscarinic antagonists can also be used.